Treatment options for arthritis. Arthritis in a joint can be caused by trauma, an underlying disease such as rheumatoid arthritis or gout, or simply be osteoarthritis, also known as wear and tear. Many things can exacerbate arthritis and make it worse, including trauma, weight, and malalignment of a joint.
I will discuss treatment options that will help alleviate pain, swelling, and inflammation.
The first we will talk about is nutritional substances. Many patients try nutritional supplements. Unfortunately, there is very little literature to support use of nutritional substances. It is not unreasonable for patients to try glucosamine or chondroitin sulfate for a few months. I advise my patients, if after 2 months there is no benefit, I would not recommend continuing using them. The second we will discuss are medications. These include anti-inflammatory drugs such as Motrin, Advil, and Aleve, which are available over the counter. Other medications include Tylenol and pain medicines. There are stronger prescription anti-inflammatory medicines that can be of benefit. All of these medications carry some side effects, which can be significant, including and not limited to stomach ulcer, kidney problems, and liver damage. Patients who are on long-term anti-inflammatory medications should have regular laboratory testing by their primary care physician. Narcotic medications should have limited use as they are addictive and they can lead to higher and higher levels of tolerance. In addition, they do not change the underlying disease process. The third item we will discuss is exercise. Physical therapy can help to restore and increase motion and strength about a joint. In general, patients are advised to exercise as much as they can tolerate without aggravating pain and inflammation in their arthritic joint. Certain exercises will increase stress on a joint and include jumping, running, impact exercise. It is generally recommended to avoid these. Next, we will discuss assistive devices. A cane, crutch, or walker can help to decrease stress on an arthritic hip or knee and can be of benefit. In addition, bracing for knee arthritis can sometimes give support and unload the arthritic portion of the joint. Weight reduction is mandatory for many patients considering hip or knee arthroplasty. The reasons for this are that it is beneficial to decrease stress on the affected joint. In addition, the literature now clearly shows that patients who have a body mass index over 35 and are obese have increased complications with surgery, including wound and healing difficulties and failure of the implants. Next, we will talk about injections. There are 2 types of injections that are commonly given for arthritis. These primarily pertain to the knee, as the hip joint is very difficult to inject, and the literature does not support giving these injections into the hip. For knee arthritis, cortisone can be used 2 to 3 times a year and help with pain and inflammation. Unfortunately, a side effect from cortisone can be weakening of tissues. Thus, any more than 2 to 3 a year are not recommended. Visco supplement injections have been used and can be used at 6-month intervals. These include either 1 shot or a series of shots once a week to decrease inflammation in the knee. We usually give up to 3 injections. Overall, the literature does not show a significant benefit in their effectiveness over simple cortisone injections. However, some patients do get relief with these.
All of the previous items we've talked about are temporary measures. Surgery is a last resort for arthritis of the hip and knee. However, it is very effective to decrease pain and improve function.